This hamster has been here for 5 days, and the main problem was the dental abscess. Dental abscess, as you can see, let's show the abscess. You see the other video, it was a big swelling, like at least 3/4 of a golf ball size. And of course now it's a much, put the light, much better. Now initially we did the aspiration, which is no use because the abscess forms again. So the best is to lance it, make a big cut. This is not big enough, actually normally it should be bigger. But anyway, there are 2 other ways of treating this dental abscess by different vets. One vet will advise to do the marsupialisation, whereby you stitch up the mucosa to the skin. So that means you stitch up this part to this part and keep it an open wound until maybe a few weeks, so the owner can clean up. The owner can syringe in the chlorhexidine. Yeah, that's what you're demonstrating now. Every day, twice a day, to clear all the bacteria inside. This bacteria comes from the jaw abscess because of the decay in the teeth. Yeah. So the owner will do it twice a day. That's what we'll demonstrate. So for me, I didn't do the stitching up, the marsupialisation, because the owner will have to come back again. But the thing is, this wound must be lanced longer so that it doesn't close overnight. Now this is one method. The other method is, according to some vets, is to take out the joint capsule. No, the encapsulated abscess. Inside there's a capsule, and go inside and cut out away the capsule, and so therefore they cut away the bacteria. But that will be quite drastic because you need to cut a big hole, and then you go inside and take out the capsule of the abscess, which I don't think is necessary. So my method is just to hospitalize it for a few days and syringe out all the bacteria and dead cells, and give antibiotics orally. So far you can see the stools. Any stools? You can see the guinea pig has eaten already, and you can see some stools here and there coming out. Now the other thing is the ear cleaning. So take the scope first, and the scope will show that there's some dirt or mites or not. So if there is, see any mites or not? Okay. Otoscope, yeah. Okay, now so then we will do the ear cleaning. Okay. Okay, we see already. Okay, this is just to demonstrate. Then the third part is the clipping of the claws. The owner didn't do it. The owner didn't clip the claws and didn't really groom the hamster. Now the claws have been clipped. It's also just a demonstration. Yeah. So either the owner send it to the groomer or the owner does it himself. Okay, so now we go to the main problem inside here. It's overgrown molars and incisors. Just open the mouth. They are the ear cleaning related. This open the mouth and you see the incisors have been trimmed. That's why the guinea pig is eating now. Open up, you see. There's some fibroplex still not swallowed. Okay, then the side, the molar, overgrown molars, which you can't see now, but I have already taken photographs in the images of the earlier videos. So this will explain why the guinea pig now eats very well. You can see from the stools, there were quite a lot of stools the last 2 days only, after the cutting away of the molar spurs. So in conclusion, when the hamster has overgrown incisors, it doesn't mean that you just come and cut the front teeth and then every month you come and cut. This applies to rabbits also. So important thing is actually, if the hamster is not putting on weight, do three things: physical examination, otoscopic examination of the mouth for the molar spurs or incisors, overgrown incisors, and then the skull X-ray. Skull X-ray, which I've shown in the this is the left side, so it'll be on the left side, left oblique. Yeah, this head will be down. Turn this. So in this case, and in X-ray, probably under sedation, then the head down, and then it's a oblique. It's a bit of oblique view. It's sort of oblique view so that you can see the teeth. Yeah, you can see the teeth overlapping rather than you see one set of lateral view only. So this concludes the case. Okay, finish. Concludes the case of dental abscess in a guinea pig. It's a lot of work to be done. It's not just come here and clip the front teeth. Poor condition, so we clip short the overgrown teeth first. We came here actually for clipping the overgrown teeth. Be careful. Okay, and then the upper one as short as possible. Okay, upper one. Now upper a bit more. We open up the mouth and check for molar spurs. Take away your finger, obviously. You cannot put your finger there. Open the mouth bigger. You can feel it with the anything sharp. You can feel the grating sound. Is there a grating sound? Any grating sound? No sound? Actually, you can see, open up first, open up one side, open up the other side. That is why we need anesthetic later on. Okay, so later on we need anesthetic. There I can see there's molar sharp, very sharp, overgrown. Yeah. The molar spurs are lower one. Okay, then we go do under anesthetic. In the meantime, okay, we just leave it first. The main problem is this one there. Okay, just take the shaver and clip board. But then we do it tomorrow. So today I will give the injection of dextrosaline and subcutaneous dextrosaline plus Marsupialisation and okay, Marsupialisation and let us see this again. Guinea pig doesn't like injection. didn't know that there's a big swelling actually. We call it the facial abscess, which is very common in rabbits when the roots of the cheek teeth are infected, and X-ray will confirm it. So now we shave first, and I will try and aspirate first. Now, as you can see, it's quite a big one. More hairs cut off. Just clip the front teeth, the molar spurs. We need anesthesia, so I will do it tomorrow. Now we have given him the dextrosaline and an antibiotic injection. The whole first. Then I would try and get the abscess out by aspiration first, if possible. And okay, so you will do from that side because you can't see the. Okay, normally this is abscess. Normally it's not the pus type. This one is a pus type. Normally it's a cheesy type. Pus type, of course, is easier. You see, you just don't need to cut. You just aspirate will do it. And this is real abscess. What causes it, I won't know. But with this, you can eat really. Okay, there's one more. Where you go first. There's one more, a bit more to aspirate. And okay, so aspirate the lowest point. Because the guinea pig is very ill, I don't want to put anesthesia in case it dies from anesthetic stress. But aspirate as much as it can. Then with the antibiotics. Now, what causes it? It could be, of course, traumatic injury as well as cheek root abscess. Only an X-ray will be able to tell. Okay, so there's quite a bit of pus here. So a bit more. There's a bit more because so you can see that. How many ml is it?
13.
How many ml?
13.
Okay, so a bit more. What happened?
Some dogs having a seizure, can they come in?
Wait, I will just let them go inside the room first.
Huh?
Go inside the room first.
No, on the phone.
Oh, okay, I'll come on. Okay, finish already. That's it. So altogether, yeah, can come in. Altogether about 12 cc. 12 cc abscess. Okay, let me go back first. Now it's about 6 p.m. 9th of November 2016. You can see that the guinea pig, about 5 years old, is actually quite interested in the food. And before that, yesterday there was a big swelling on the chin, and it wouldn't be eating. Yeah. So after lancing off the swelling and the pus and giving antibiotics and dextrosaline for the last 2 days, you can see there's much improvement in this guinea pig who has been written off here. So definitely you can see he is really more active. Now the swelling is abscess on the cheek. Now, as to the cause of it, I would suspect, like the rabbit, it could be a molar tooth abscess. This can be confirmed by the X-ray, which I will do tomorrow, and the molar spurs I will do tomorrow to file or cut away the spurs. So you can see his nails are really very long, so he wasn't groomed, poor fellow. But other than that, he seems to have be more interested in his eating. So we already filed the teeth, the front teeth, which you can see in another video. And now is the day 2. You can see he's really hungry, eating. Though you can see his backside. You can see his backside. But I will close and let him have his privacy. So let him go that side. Okay, so now he really is a bit worried. So tomorrow he's much better. Then I will do the anesthesia, file the molar teeth, do the x-ray of the right side to see whether there is abscess or not. So we should expect him to be much better tomorrow morning, day 3. Today is November 9, 2016. Mr. Donald Trump is the President of the United States. And it's a significant day for Americans. So it is very interesting that 2 days ago, his overgrown upper and lower incisors forced him to be very thin and anemic and couldn't even eat. And now, after 2 days of subcutaneous food therapy, antibiotics, and painkillers, and of course clipping his molar teeth back to the short length, you can see his appetite has returned very well. And then of course the abscess on the left face had been drained and lanced, and he did poop a lot. Also, I did an x-ray today. X-ray did show some molar spurs, which I will file off when he's much better tomorrow. But we're here 2 days and you can see this recovery is so good. Yeah. Now this cage is meant for actually the cat. You can see the perch. So we were transferring to the proper cage where the water bottle can hang, and then also more. You got a bigger water bottle there. This is the proper cage for the guinea pig, as you can see. It's designed for rabbits and guinea pigs. Now this guinea pig had a dental abscess on the left side, and it had been lanced and drained. Now with 2 days of subcutaneous Baytril plus dextrosaline, you can see he has recovered his appetite as well. And he's even eating the seeds as well. There's a lot of stools. Now the pus is really foul smelling. This pus, first of all, aspirated from the abscess. It smells like rotten shit, rotten stools. So it's about maybe 12 ml. And I've done an x-ray as well today. He's much better and not so pale. And just now you saw the other video, he was quite active drinking, no more squealing in pain. So tomorrow I will check his molar spurs. Actually shows that there's a crooked tooth as well, and I will check it under anesthesia and extract out the tooth and smoothen the molar spurs. Today is November 10, 2016, about 7:15 p.m. This case shows the importance of skull radiography for guinea pigs or even rabbits with dental problems. Now in this case the history is very interesting. Last year, December 2015, the guinea pig came in with overgrown incisors, so I persuaded the owner to have a proper examination with the guinea pig under anesthesia. So, but there was no x-ray taken because to save cost. So I trimmed the incisors and the molar spurs. And after that, with antibiotics and painkillers, the guinea pig was okay from December to July, and the owner remembered that. But from July, August, September, and he came here for just to trim the incisors only. So it's cheap. He doesn't want any veterinary oral examination or any other things. So he was not aware that actually the molars are overgrown as well. So finally, recently November 2018, I saw this guinea pig was in a bad shape, very thin, lethargic and anemic, and this time I persuaded him to have a skull x-ray because there was a big abscess on the left side of the cheek, lower jaw. So I drained the abscess. It was foul smelling, very smelly. I think you saw the other video. And I give antibiotics for 2 days. So now you can see the guinea pig is eating now from the other video. This video is on the x-ray. And so I analyzed the skull x-ray left oblique view. You can see the M2, molar 2, second molar. Now the guinea pig has 3 molars and 2 premolars. So no, it has 3 premolars and 3 molars. So there's 6 teeth. But so you can see the left molar 2 is already fractured or loose, and then there is a black area which is actually the mandibular bone has already been infected, and this is where the abscess, the pus comes down. It comes down and it accumulates under the left side of the face, the lower left side, becoming what we call a dental abscess. So x-rays are important, and you can see that from the arrows. You can see that the tooth is definitely loose and half protruding out. So this will have to be removed when the guinea pig is stronger, because you need anesthesia. So remove this tooth and then trim the molar spurs, the sharp end molar spurs, which is not so obvious on this x-ray, but you have to use the otoscope to view all these sharp areas. These are the molar spurs, and so this x-ray is definitely, skull x-ray is definitely important. The left oblique view, where the mouth is opened up using strings to open the mouth and tilt the head. The left oblique view is because the abscess is on the left side. Now you can see that of course this one, the incisors have been trimmed, so, and the parts have been drained before I do any x-ray, so that you can see clearly. Otherwise it will cost more money to do more x-rays. Unfortunately, we need to save money, so this is only one x-ray. There's no ventral dorsal view, but you can see quite clearly that definitely there's a dental abscess. Of course, physical examination, you can see it. Physical examination, radiography, you can tell. And I've not done the otoscopic or endoscopic examination of the mouth yet, because the guinea pig is in a poor, about to die condition. So there are the 3 criteria: physical examination, otoscopic oral examination, and skull radiography to diagnose dental abscess or disease in guinea pig or rabbit. November 8, 2016. Toa Payoh Vets. Time is 8:10 p.m. Singapore. I leave the clinic, I'll say goodbye to this guinea pig, and I think he does, he's definitely more active, as you can see, and earlier on you can see the other videos, he's more alert, and the left side is here. You see, I need to drain again tomorrow, open up this so that what you call Marsupialisation, so they can drain more. Otherwise, the wound closes again. So tomorrow, under anesthesia, then we will do that. That means leave the wound open to let the pus comes out, and of course, extract the loosened M2, the lower M2. And you can't do everything at one shot now, or early on, because the guinea pig was in a poor shape. He will just die under anesthesia. You can't do without anesthesia as well. So, otoscopic examination or endoscopic examination of the mouth, physical examination and skull radiography are the three parts of the diagnostic process of dental disease in guinea pigs or rabbits not eating. Toa Payoh Vets, November 10, 2016. 5-year-old male guinea pig, which is quite active now, as you can see, compared to 2 days ago when he was just not able to stand up. November 11, 2016, 6:15 p.m. This guinea pig had been anesthetized 2 hours ago, and I trimmed off the molar spurs, the premolar spurs, mandibular left and right, PM1, and also I clear out the loose teeth, M1 on the left maxilla upper jaw, and there are some spurs in the molars as well on the M1 on both sides. So they were trimmed, and now you can see he's really happier at eating hay as well as drinking water. Now he has not passed any motion yet. He was given another dose of antibiotics and painkillers, and I expect him to be much better now. The abscess on the left cheek was drained again because there was some pus accumulating, and flushed. It's a encapsulated abscess since it's been quite a long time, and you can see from here, not very clearly, but on below you can see it below his eyes. I don't want to disturb him as he's busy drinking, but you have seen sufficiently in the earlier videos here. So this abscess still has not been cleared fully. It needs to be flushed every day, otherwise it just closes up and then reformed another abscess. The very smelly pus. Now I'm glad that this fellow is actually quite active now as compared to 2 days ago. See, he's really thirsty and drinking, and he probably eats some hay because I saw him eating hay. I just opened up this cage You can see his abscessed area. Below the eye, there's a bit of skin shave off, but now it's much smaller, the lump. Used to be a big golf ball sized lump full of smelly pus. And let's see whether it eats hay or not. It's quite alert and more active here. I gave him some seeds as well, some hamster seeds. So he has 3 days of antibiotic injections, plus painkillers. You can see that definitely his abscess is much reduced, the swelling. It's not obvious, but definitely he's more active, as you can see. He's eating, probably able to. The overgrown incisors were trimmed 2 days ago. The abscess was incised and drained yesterday, and the molar spurs, overgrown molars, were trimmed, and the loose molar tooth was taken out, bits of it. Yeah. So now he can eat very well. So you can see that he's really eating as expected of a normal guinea pig. Tomorrow we will drain the abscess again, because it's a very thick and encapsulated abscess. It has been going on for some time due to the mandibular being infected, the bone is seen in the X-ray. So diagnosis is dental abscess, overgrown incisors, and molars, causing weight loss and poor condition. No interest in eating at all. November 11, 2016, 6:30 Friday, 6:30 p.m.